Hello, my name is Dr. Bob DeMaria, the drugless doctor, and today we're going to get to know about strokes and stroke prevention. You know, so many conditions that people suffer with on a regular basis insidiously creeps up on top of them, and individuals don't know what to do. If you have had a family member that's had a stroke or a really close relative, whatever patterns that they were following, you're going to have a greater chance to suffer the same condition. There are 2 or 3 areas that I have seen that are common patterns with individuals who have strokes. First, people who smoke cigarettes. When you smoke a cigarette, it takes vitamin C out of the body. Vitamin C is very important for tissue integrity, tissue strength. Smoking is not smart, but if you do smoke, I would for sure be taking some vitamin C on a regular basis. But probably one of the more common causes for strokes are individuals who have high blood pressure challenges. You see, people who are overweight tend to have blood pressure problems. Now, being overweight does not guarantee you're going to have a blood pressure issue, but I want to briefly talk to you about blood pressure right now. When your heart beats, a part of the heart is called the ventricle that pushes blood throughout the body. For every pound that you're overweight, it adds 200 miles of extra blood vessels. When that occurs, that heart pump has to push harder. So the normal blood pressure, let's just say, is 120/80. But if you tend to be overweight, and or if you have a lot of stress in your body, or if you increase your sugar consumption, your blood pressure is going to tend to go up. The reason that blood sugar is going to go up and impact your blood pressure is when you eat sweets, sweets increase insulin. Insulin causes sodium retention. Sodium retention causes more water to be in your body. When you have more water in your body, you're going to have increased blood pressure challenges and then eventually stroke. See, when that heart is pumping really hard and it's moving blood and it goes to a blood vessel in your brain that's already been weakened because of poor dietary challenges, that little blood vessel can literally burst or break. There's another thought that I want you to really pay attention to is blood thinners. I know many of you are taking blood thinners right now, and I'm not here to tell you to go off of your blood thinners. But what I've learned from my experience is if you take blood thinners, and I want you to be aware of this, and you may add marine oil or flax oil or aspirin or any other type of item, whether it be over the counter or prescribed by a physician, it can also thin your blood so much that the blood vessel itself could have a little hole in it and you could literally have a stroke. So first we need to control your blood pressure. Second, you're going to want to watch weight, how much extra weight you're carrying in your body. Remember, 1 pound of weight adds 200 miles of extra blood vessels that your heart has to pump that body and that blood through your entire body, which could be stressful and a challenge. Look at the medications that you're taking. Medications have side effects, and you want to make sure that the medication you're taking does not have stroke as one of the side effects, because in the past there have been people who have been taking medications for weight loss that actually ended up having a stroke. And in my practice, I saw many patients that have had that done. Now, it's not uncommon even for younger people today to have strokes, and part of that could be because of birth control medication you're taking that can also weaken blood vessels. I think what's so significant is that anything that will raise your blood pressure, oftentimes when people are underneath a lot of stress and their blood pressure can go up, if you feel pounding in your head, it might not be a bad idea for you to have a vascular analysis of your head. I know that they do Doppler testing, ultrasounds of blood vessels along the front of your neck region to make sure that you do not have hardening of the arteries. We talk about blood vascular flow in Dr. Bob's Trans Fat Survival Guide. The real key to help prevent long-term stroke challenges is to minimize the amount of inflammation that's inside of your body. You can do that first and of course by minimizing sugar. Sugar causes inflammation. But I mentioned Dr. Bob's Trans Fat Survival Guide. Trans fat causes inflammation. An inflamed blood vessel is a blood vessel that's going to have a greater chance to have weakness, and it can very easily break. Just a little bit of a drop of blood is all you need to have a stroke. So you want to be taking good oil. That's one of the reasons that we encourage our patients to take at least 1 tablespoon of flax oil per day per 100 pounds. If you're on a blood thinner right now, and if you're also taking aspirin, I would talk to your prescribing healthcare provider. You do not, listen to me, you do not want to take any marine-based oil, whether it be a salmon, anchovy, or sardine or tuna oil, the same time that you're taking a blood thinner. I may encourage you to have an essential fatty acid blood spot test done to determine the exact levels of fat and good oils that you have inside of your body. It's also very important to make sure that you're consuming fresh vegetables, especially red, yellow, and orange bell peppers. We've talked about those on other parts of the Get to Know series, especially for fall and spring vegetables, because the vitamin C is going to improve the tissue integrity of your cells. If you smoke cigarettes, I want you to think about this. Smoking cigarettes minimizes vitamin C inside of your body. Drink water from a pure source. Make sure you minimize sugar. Exercise regularly. Make sure you get adequate sleep so you can reduce the amount of stress that you have inside of your body so your blood pressure does not go up. I'm Dr. Bob DeMaria, the Drugless Doctor.